Awesome. I am Dane Zahner. I use he, him pronouns, and I'm Southern Oregon's prevention manager with HIV Alliance. And, we're here about ending hepatitis C in Oregon. And I'm going to talk a little bit about our programs and how our goal is to end hepatitis C. I'm going to talk a brief about our services, HIV testing, the hep C testing, syphilis, and I just wanted to start, what are prevention services? What the best resource is to eliminate Hep C is if somebody's actively using injection drugs, is to have a syringe exchange program or one for one. And we try to make sure people have new equipment so they're not reusing and sharing equipment, wound care kits, referrals to care, naloxone, transneedle exchange. Again, we don't want people to use if they're injecting hormones, those closed food and condoms, just resources that we take out to the street. Um, we screen everybody. We do three different tests, and so I included our HIV test. We hit the risk. We want to identify like how we can help support somebody. This is a great opportunity to encourage somebody to take PrEP while you're testing them for HIV. There's definitely a risk, and we want to do tour that. We do that hepatitis C testing, and again, we ask a bunch of pinpointed questionnaire during that council to find out their risk and then educate them on how to reduce that risk, but also get them screened at the same time. And, from this, we're going to immediately, if we have a reactive test, we can, if we're in the office, we can connect with our peers, enroll them in our path peer assisted telehealth program. And if we're on the street and we're over in Coos County, Curry County, we could use Barrier First Step. We can use ADAPT. There's multiple different agencies doing that peer assess. So really, we can take somebody from a test on Hep C, get that blood panel done that day, and maybe within a 2 week time period, get them up to OHSU telehealth or a Viva clinic. Right here in Douglas County, they are doing an amazing job and have enrolled so many clients. So there's another opportunity to send them over to Aviva to their Hep C clinic, which hopefully we see them expand that into Josephine and Coos County with some other collaborative medical organizations and the FHQs and getting them to do what Aviva Health is doing here. We also run a syphilis screen. And again, the peers can help with this. So if we have a reactive test, we can get them over to get their blood work done to find out where they're at, what medication is going to work. But again, assessing those risks so that we can help detour new syphilis infections and get that care that person needs. This are testing in all counties. And I think one thing I look at is how many more Hep C reactives and how much less funding we see around Hep C. So HIV, we ran 1,953 tests in all of our counties last year. We had 11 reactives. And Hep C, we ran 1,541, 10 times more reactive tests, 115. And we know the funding's not there. And so, but things have come so far with the peer assisted telehealth, Aviva's clinic here in Douglas County, and hopefully we'll have Siskiyou Health on board here in Josephine County, and then Waterfall Clinic over in Coos County. And we can just be rolling with local medical providers offering that care, which there's been a lot of barriers. That's why PATHS is so successful. Syphilis tests, again, 1,579 tests, 68 reactives, a lot more than our HIV. I'm not minimizing any of these diseases, and that's why we run all three because we want to connect them to care. But I think that Hep C, that's the focus of today, is really big, and especially when we see so many more reactives in our testing program. And if you look at Gilead's representation, about 40% of active drug users possibly being at risk, we really need to encourage more people to screen around hepatitis C anywhere and everywhere. Why not when you're waiting in the waiting room, have somebody run a Hep C test on you? That would be an ideal world to get those people screened. We do naloxone. It used to be just HIV, and then we added Hep C, and we've added syphilis testing. Naloxone and overdose prevention is huge. 47,000 doses last year. And look at what I really like to point out is how many more lives we saved. We were pretty much equal with what was lost. So that's just our data. Oregon, I think, saw about 1,800 people that were lost last year to overdose. And we want to minimize that, but we in our 7 counties, saved 1,800 lives. So we're equal in that, and we just got to keep going, get more naloxone out there. And that's part of the picture. So, Hep C, the highest risk factor is injection drug use. So that naloxone, there's already a risk there, is making sure when they get tested, we also get them naloxone so they can save their lives. I just kind of wanted to breeze through our counties, but Curry County, we are in Port Orford, Brookings, Bandon. We know that's in Coos, but we display that on both of our slides. Our Gold Beach operation, every 30 minutes in Curry County, somebody can access care once a week. So that's 3 different events every single week. So that's a lot of access. Coos County, same thing. We have multiple agency outreach events that go around there, but we're in Coos Bay, North Bend, Coquille, Myrtle Point. Again, Bandon, as mentioned, we know it's in Coos County, Lakeside, Powers, just really making sure we meet people where they're at. That's what is harm reduction, and that access to testing, access to new equipment, access to naloxone. Douglas County, again, multiple. We're in Douglas County here in Roseburg, Winston, Sutherland, Glendale. We go up to um, we have a connecting point initiative here where we're going out on the streets, again, connecting people, making it accessible. The point in Roseburg where a lot of our unhoused population is camping. We go in there at least weekly. OTP now has a drop-in site on the same Thursday so people can get access to testing, and that's really been a great event. In Roseburg, we do the jail testing. We do testing over at the OTP. We use Crossroads, just trying to make that testing accessible so they can get a baseline on their HIV, Hep C especially, and syphilis. And then Grants Pass in Josephine County. We got Grants Pass, Cave Junction, Wolf Creek. Again, multi-partners and working with different people taking testings like Option, the hubs, and it's just a great resource on connecting people to care and making it so easy to get that screening done. And then, we're volunteer based and we have some agency personnel, but we can't do it without our volunteers. So if you live in our area or know people in our areas that are looking internships, we can train them to do everything we do. That includes our testing so that we can increase that testing and hit that mark and make people understand their HIV, Hep C, and syphilis results. You know, I just appreciate your time today. Again, my name's Dane. I go by he, him, and I'm Southern Oregon's prevention manager. And our goal here is to end hepatitis C in Oregon. And it takes all of us as a team to get people screened and get them to care. And look what's happening in Douglas County. You have the PATH program, the Peer Assisted Telehealth with HIV Alliance. You have ADAPT. But now we have a Viva's clinic. Yes, a hepatitis C clinic at our FHQ that we can enroll people. So it's just one more option to get people to care around hepatitis C. I just appreciate your time today. Thank you so much.